If you've been following my content, then you know I talk a lot about ADHD. And one of the biggest challenges for people with ADHD is emotional dysregulation, which just means that they can have really intense emotions that can be hard to control. And sometimes it can even take a while to kind of rein those emotions back in. And now, because of how this looks on the surface, unfortunately, this is sometimes confused with other mental health conditions. And as a psych provider, one of the things that I see the most is people actually confusing symptoms of emotional dysregulation with bipolar disorder, or just simply using the term bipolar too loosely to describe any type of intense or rapidly changing emotions. And now it is true that both ADHD and bipolar disorder can affect your mood and emotions, but they're not the same thing. And understanding the difference matters because it impacts how, the symptoms are interpreted, how they're diagnosed and how it's treated. And because I know firsthand, that there is a lot of misunderstanding around bipolar disorder and that it does actually get simplified as just mood swings. Today, I'm actually going to be spending some time and focusing on the diagnosis of bipolar disorder, diving into what it is, the different types, how it shows up, and how it's treated. So let's break it down.
Take a whole day to recognize sunshine. When you need someone, I will be by your side. Hold on. There is a light that shines. That's for you and me. Yeah.
Hey guys, welcome back to the channel. If you're new here, I'm Tamika and I'm a board certified psychiatric mental health nurse practitioner. I also go by the name The Flagrant Psych MP. I run a private mental health practice in Michigan, but on this channel, we talk about mental health in a way that actually makes sense in real life. As I said earlier, we're breaking down bipolar disorder today. So if you aren't familiar or just not clear on what it is, go ahead and grab a seat and tune in because this video is for you. Now, at its core, bipolar disorder is about episodes, which means they're going to be distinct blocks of time, not quick mood shifts, but distinct blocks of time when a person's mood is shifting, their energy levels, their activity levels, and just their normal demeanor or behavior are going to be noticeably different from how they usually present. And when a person is experiencing these episodic mood shifts, they're going to actually be falling into one of the following three categories. And that's going to either be depression, mania, or hypomania. And we're going to talk in more detail in a minute about what these mean and what they look like. But what's important to know right now is that when these episodes hit, these mood shifts can seriously and noticeably affect a person's relationships, their work, their decision making, and even their physical ability. Now, did you know that there are three main types of bipolar disorder? Yeah, let's talk about it. First is bipolar 1. And now, when most people think about bipolar, this is probably the version that they're referencing or thinking about. And it's also the one that's consistently portrayed and talked about in the media the most. And so, this type of bipolar disorder is going to involve full mania or full manic episodes. And what is mania or manic or being manic in the first place? Well, you've probably heard some people explain it as being in this state of overwhelming, blissful happiness. And I've even heard some of my patients describe it to me as feeling high off of a substance when there's absolutely no substance on board. And so, believe it or not, when patients are manic, they actually like and welcome this feeling. But in reality, mania can be incredibly dangerous and debilitating because during this time, you may see that people are going to be sleeping only 2 to 3 hours or less a night and still feeling energized throughout the day. They may start multiple projects, and I mean like big, ambitious projects like starting a business or writing a screenplay, for example, all at the same time. They might start talking fast and thinking fast, like their brain won't slow down. They may even start feeling unusually confident and sometimes too confident, like believing they have extraordinary talents or superhuman abilities that defy reality. They may also engage in spending money impulsively or making risky decisions like becoming hypersexual. And then sometimes, guys, if the mania symptoms are severe enough, it is highly common to experience psychosis, which includes hallucinations and delusions. Delusions are an unshakable belief about something that is completely untrue, and hallucinations involve hearing and seeing things that aren't really there. Now, it's said that roughly 48% of manic patients present with at least one delusion, and up to 71% of people with bipolar 1 will experience symptoms of psychosis in their lifetime. And when this happens, when it is this severe, it usually requires hospitalization to help these patients stabilize their mood. I also want you to know that during a manic episode, these symptoms must occur for at least 7 consecutive days to be classified as a full manic episode. However, if hospitalization is required, even if that 7 day criteria hasn't been met, that's going to automatically qualify as a manic episode. And now, what happens when the manic episode ends? Well, with these patients, they're almost always going to experience a biological and physical crash, and they're going to experience like severe exhaustion, a sudden drop in mood, maybe confused, and sometimes even the emotional weight of dealing with the impulsive actions or decisions made during that high. Now, during this crash, it can sometimes lead to a deep depression, but not always. So a person can crash from a manic state and then go back to their normal baseline presentation. And that's a defining factor of bipolar 1 that I want you to remember. Sometimes there is no depressive state at all, but there will always be full mania with this diagnosis. Now, next there's bipolar 2. Now, bipolar 2 is somewhat similar to bipolar 1, but the difference lies in how the mania and depression shows up. For example, in bipolar 2, mania is actually referred to as hypomania. And that prefix hypo means below normal or less than usual. So if we apply that to bipolar 2, when people experience hypomania, it just means that it's a less milder or less severe version of mania. And now you're going to see the same type of symptoms that we just went over in mania, like increased energy, reduced need for sleep, and feeling unusually confident, but at a lower intensity. And so people can still typically function daily with hypomania. Like they can still go to work and go to school. And so in real life, a person experiencing hypomania may say things like, I'm super productive this week, or I feel amazing. I don't even need sleep like that. And so again, when people feel like this, they don't see this as a problem. But just like in bipolar 1, the problem arises once that hypomanic episode resolves and then they experience that crash. Now, when patients with bipolar 2 crash, they almost always transition into a deep depressive episode. And during this episode, these patients may feel exhausted no matter how much sleep they get. You may find that they're canceling plans. These are things that they were really excited about doing, but they're canceling plans. Basic things may feel overwhelming, like texting or doing laundry. They may feel disconnected or be harder on themselves. They might also experience suicidal ideation. Now, these depressive episodes can last a long time and can be extremely debilitating. This is actually what triggers a person to actually seek help for what they're experiencing. But the issue that we see here is that because the patient presents as depressed, unfortunately, if the clinician assessing them isn't asking the right questions, they might sometimes get diagnosed with a major depressive disorder versus a bipolar disorder. And treatment for the two are different and can make the difference between seeing improvement or getting worse. So I want you to know that as clinicians, if you were ever diagnosed with a major depressive disorder, we would be doing you a disservice if we did not also take the time to carefully rule out a bipolar disorder. And also know that you can't have two individual diagnoses. Like you can't have depression and bipolar. It's either one or the other. Now, bipolar 2 diagnosis is fairly common, believe it or not, but let me also add that in my clinical experience, it's also one of the ones that can be overdiagnosed. And I often see people diagnosed with bipolar 2 when the symptoms are actually better explained by another condition like ADHD, but that's something that we're going to get into deeper in another video. Now, the third type of bipolar disorder is actually called cyclothymic disorder. Now, this form is more subtle than both bipolar 1 and bipolar 2. And what you're going to see here are mood changes that last for days or longer, not just everyday ups and downs, right? The highs don't reach full mania and the lows don't meet criteria for full depression either, but the mood shifts can still affect work, relationships, and daily life. And so what this can look and feel like is like you're always a little up or a little down. That's that hypomania or depression. You're never fully stable for long. There are periods of baseline presentation, but not for long. And then people might actually describe you as being emotionally inconsistent. Now, to make this diagnosis, adults must be experiencing these type of mood shifts for at least 2 years. It's going to be 1 year for children and adults. And those hypomanic or depressive symptoms, they have to be present for at least half that time. But all things said, guys, I'm going to be honest. This one is tricky and it can be extremely difficult to capture in practice. So it's essential for accurate mood charting between appointments. And then you have to have consistent assessments over time with your provider to make sure they're as accurate as possible with this diagnosis. Now, all of these diagnoses have some symptom overlap. So, how do we effectively distinguish the three, right? And that's a really good question, and it can get tricky, but I'm going to give you some key identifiers for each. Now, remember with bipolar 1, there's going to be manic episodes. The mood is elevated, there's irritability. A person is energized to a degree where it causes marked impairment in their ability to function. And these symptoms are happening for 7 days consecutively or less if it requires immediate hospitalization. And sometimes you can see psychotic symptoms like hallucinations or delusions with bipolar 1. Now, a person with bipolar 2 experiences hypomania. Again, there is mood elevation, there's irritability, increased energy, but these people can still generally function, like go to work and school during these episodes. And the burden with this diagnosis is typically that depression that keeps happening and becomes very debilitating. Now, with cyclothymia, these individuals are going to be experiencing recurring periods of hypomanic symptoms and depressive symptoms. However, the severity, the number of symptoms, or the duration of these ups and downs, they never fully meet full criteria for, a hypermanic or major depressive episode. And what I've done is I've included a comparison chart in the description to kind of help you visualize this a little bit more because I know I'm a visual person. And I've also included a couple of other conditions that get confused with or share some of the same symptoms of bipolar disorder. So go ahead and download it and take a look at it when you have some free time. So, bipolar disorder is best understood as a brain regulation problem, not just mood changes. So, I kind of want you to imagine your brain has a mood thermostat, right? And a healthy brain can constantly adjust your mood, your energy, your sleep, your motivation, even your emotional responses. Sort of like a thermostat that's working to keep the room temperature at around 70 degrees Fahrenheit. Well, with bipolar disorder, that thermostat doesn't regulate as smoothly. Instead of staying near the middle, it can overshoot, right? And if it overshoots or if it's too high, it can result in mania or hypomania. And if it's too low, then you can likely see depression. And then to top it off, the brain has a difficult time returning to its usual balance. You also have certain brain circuits becoming excessively active, especially during a manic or hypomanic episode, which can lead to racing thoughts, a decreased need for sleep, increased confidence, impulsive behavior, increased goal directed activity. And during depression, many of these same circuits actually become underactive. There's also neurotransmitter fluctuations, so brain chemicals such as dopamine, glutamate, serotonin, norepinephrine, right? These are all, brain chemicals that help to regulate mood and motivation. But in bipolar disorder, there appears to be an abnormal regulation of these signaling systems. And sleep and the body's internal clock become unstable in bipolar disorder. Actually, one of the strongest findings in bipolar research involves the circadian rhythm, which is the body's internal 24-hour clock. And many people notice that when they experience sleep loss, it can actually trigger mania. Irregular sleep actually worsens symptoms. And so restoring consistent sleep helps stabilize the mood. So this is one of the reasons that protecting sleep is considered a cornerstone of bipolar treatment. The brain actually becomes more emotionally reactive with bipolar disorder, and brain imaging studies suggest that areas involved in generating emotion can become more active, while regions responsible for planning, self control, and regulating emotions may not keep pace during these episodes. And that actually explains why emotions, energy, and behavior can become much harder to regulate during episodes. And so, to sum it up, guys, it's important that you understand that you can't just control these episodes, right? This is a medical condition. It's not a personality issue. Let's talk about what actually helps. Like, how do we manage all of this? Because this is the part that people really want to know, the part that people really need. And honestly, with this type of condition, medication is, what's going to be helpful for most people. And I'm talking like mood stabilizers like lithium, valproic acid, or lamotrigine, or maybe antipsychotics like quetiapine or aripiprazole, for example, and sometimes antidepressants, depending on the situation. But note that antidepressants should never be used, typically never be used alone for bipolar disorder, because it can trigger a manic episode. And I'm going to be real with you here. Finding the right medication can take time, right? We have to balance everything out. The right medication, the right dose. Do you need oral? Do you need an injection? Are you having any type of intolerable or adverse side effects? And those are all things that you will work very closely with your provider to fine tune. But I will say, once it's right, once we fine tune that regimen, it can be very life changing for people with this condition. And therapy helps too because it can help develop self awareness and provide support. It can teach you to ask important questions like, what does the beginning of an episode look like for me? And this can help you to better understand your patterns as it relates to bipolar disorder. It can also help in the sense that there's someone else around who can gently say to you, hey, you don't seem like yourself lately, and then help you build routines to help keep you stable. Now, the types of therapy that can be helpful are cognitive behavioral therapy or CBT, there's psychoeducation, and interpersonal and social rhythm therapy or IPSRT. And we can never ever discount lifestyle. This matters more than people think because a lot of people, remember, I told you, notice their episodes are tied to sleep disruption or major stress changes. So you got to be doing things like protecting your sleep. Essentially, you got to be very intentional about making sure that you have a good sleep routine on board to make sure that you're getting restful and restorative sleep. You also want to have some structure in your day, and you want to do things to manage your stress like walking or yoga, and be very mindful to decrease or omit alcohol or substances. Now, if any of this sounds familiar, especially the cycles of high energy and low mood, and the risky behavior during high periods or depressive episodes that keep coming back, it's worth getting evaluated. And I want you to know you don't have to wait until things get really bad to do that. So, bipolar disorder is complex, but it's also manageable with the right support. And if you take anything from this video, let it be this: understanding your patterns is powerful. Now, if this was helpful, go ahead and like and subscribe and share it with someone who you think might need it. As always, guys, thanks for joining. And until next time, take care of yourself. Bye.